Perfect. Hello, my name is Twisha Thote, and today I will be presenting about stem cells and neurodegenerative disease. There we go. So here's a brief table of contents. I will first be introducing stem cells, then neurodegenerative diseases, and then talking about stem cell therapies for these kinds of diseases. So in an introduction to stem cells, questions answered include, what are stem cells? Where do they come from? And what do they do? Stem cells are the body's, quote, starting materials. They are the original or progenitor cells, which can specialize into various types of cells in our bodies, as shown at left, including lung cells, brain cells, and a lot of others. Now, stem cells have three main sources: the embryos, the adults, and the umbilical cord. The ones from embryos can differentiate or specialize the most, while the ones from adults have the least differentiation potential. Now, why are stem cells important? There are three main reasons. One, watching them specialize can tell scientists about how diseases can progress. Two, they can be used to generate new healthy cells to cure diseases like spinal cord injuries, type 1 diabetes, and more. And three, scientists can test effectiveness of drugs in clinical trials on stem cells before testing in humans. Now, on to neurodegenerative diseases. Questions answered here include, what are neurodegenerative diseases, how do they affect the brain, and what treatment options are out there? Now, neurodegenerative diseases are conditions that occur because of the declining function of neural cells. These can include many diseases that are common but not normal when it comes to aging, such as Alzheimer's, Parkinson's, and amyotrophic lateral sclerosis, or ALS. How these affect the brain? Now, neurodegenerative diseases can affect many different types of cells in the brain and many different areas of the brain, resulting in a huge variety of symptoms. Common symptoms of these kinds of diseases include the following: loss of motor control, memory loss or dementia, anxiety, and agitation or irritability. What treatment options are out there? Currently, there are no authorized therapies for treatment, but methods in clinical trials now include drug-based treatments such as levodopa and carbidopa for Parkinson's, and stem cell therapies for Parkinson's, Alzheimer's, and many others. If these get approved, they are a huge step compared to current symptomatic treatment methods. Now, stem cell therapies for neurodegenerative diseases. Questions answered include, is there a way to cure these debilitating diseases, and what kinds of cells could be used? Now, scientists may be able to inject stem cells into diseased organs in the body, curing diseases like Alzheimer's, Parkinson's, ALS, and many more. Stem cells can have varied effects depending on which type you use. Mesenchymal stem cells, or MSCs, can reduce inflammation and scarring, while induced pluripotent stem cells, or iPSCs, can replace damaged cells to repair tissues. Now, how does stem cell treatment differ from other methods? While current treatment methods can offer symptomatic management, stem cell therapies really open the door to a cure for many different types of debilitating diseases that people used to just have to live with. It can also be better than organ transplantation if stem cells originate from the patient, because this can lead to a lowered risk of immune rejection and could possibly lower the need for immunosuppressants. Here are some sources I used. And that is all I have for you today. Thank you for listening, and if you have any questions, feel free to ask me.